Hello, I'm Dr. Haydee Brown.
And I'm Dr. Sonya Sloan, and we are eh-yah,
Black and Brown Women Disruptors in Healthcare and Beyond. Let's roll the clip.
So my main mission at HHS, in which I hope that you will all join me, is to reverse the chronic disease epidemic in America. How are we going to do that? It isn't by replacing one paradigm with another one by force. I'm not going to come in here and impose my belief over any of yours. Instead, we're going to work together to launch a new era of radical transparency. Only through radical transparency can we provide Americans with genuine informed consent, which is the bedrock and the foundation stone of democracy. Transparency allows diverse parties.
Well, that didn't take long. Robert F. Kennedy Jr. has barely warmed his seat at HHS, and already his department is rolling out a directive straight out of the far-right playbook, also known as Project 2025, because science and fundamental human rights are optional under this administration. RFK Jr. has barely stepped into his role as HHS secretary, and he's already wreaking havoc. In just his first week, we're seeing exactly what happens when you hand the nation's top health agency over to a conspiracy theorist with a long history of undermining science. From pushing an extremist binary definition of sex that erases trans and intersex people to interjecting politics into vaccine policy by gutting advisory committees, RFK Jr. is proving he's not here to protect health. He's here to dismantle it. And let's not forget the bigger picture. This isn't just about RFK Jr. This is Trump's playbook in action. Every move Kennedy makes is part of a broader strategy to roll back rights, weaponize public health, and reshape science to fit a far-right agenda. If this is just the beginning, buckle up, because the damage could be catastrophic. What do you think, Dr. Sloan?
I think catastrophic is a great word. Catastrophic may not be a big enough word, but let's really call it what it is. It is straight up censorship, right? And the major area that this administration wants to destroy is the LGBTQIA plus community. The CDC, you guys know who that is. It's the nation's top health agency, the top health agency, what we've always trusted. They're now forcing the scientists there to pull all research papers and publications so that Trump's administration, non-scientists, can scrub it clean for so-called forbidden terms. Now, you guys, in 30 years that I've been in medicine, I've never heard anything in medicine called a forbidden term. Let's watch this clip.
In one of Robert F. Kennedy Jr.'s first moves as Secretary of Health and Human Services, the agency has released new guidance that gives a narrower definition of sex than the ones used by most scientists.
And this language aligns with an executive order that President Trump signed last month and includes new definitions for words like sex, female, woman, male, man, and more. CNN's Jacqueline Howard joins us now. Jacqueline, walk us through this new guidance.
Yeah, what I can tell you, this new guidance defines sex as, quote, a person's immutable biological classification as either male or female. So this means this definition cannot change. And a woman is defined as an adult human female and a man as an adult human male. So that's what the guidance states that was just recently released. Now, in response, Boris and Brianna, we are hearing from some critics who say the new definitions fail to account for people like those who are intersex. Up to 2% of the U.S. population is born intersex, meaning that their reproductive anatomy does not really fit the male-female binary. And then there's other criticism saying that this perpetuates discrimination against the trans community, and this could lead to discriminatory policies and practices. So we are seeing these responses in the wake of this new guidance being issued.
And so as a physician, I recently had to stop using anything that was other than male or female in our physical notes that we take when we're talking to patients. So what are these dangerous words that need government approval? Like, we haven't been to medical school all these years, Dr. Brown. It's gender, transgender, pregnant person, LGBT, and non-binary. So get the idea. I think that we can use certain things that they approve of, but other things we can't. So acknowledging existence of trans or non-binary people, Trump's administration wants to get rid of them. They want to erase it. So Jeremy Faust, he's a public health expert, says that it's not just an oversight or them trying to, sort of sweep it under the carpet. This is full-blown ideologic purge of science, you guys, science. The administration wants to control the narrative, thereby deciding what medical journals can publish. These are non-scientist people that have been appointed to positions that not even been voted on, that are deciding the fate of our health in the United States and policies. So this isn't accuracy or science. It's about forcing their extremist views onto public health policy. They want to scrub the words so they can erase the people, the 2%. So let's be clear. This is authoritarians. This is what they do. They want to control the language, control the research, and ultimately control lives. And if they're willing to do it, you guys, on the CDC level, just imagine what's coming next. So Dr. Brown, I can't imagine what you got.
A head shake. I've got a head shake there. But, recently the HHS issued a new policy declaring that biological sex is strictly binary, right? Either you're producing eggs or sperm, and that there's no nuance. And let's just not forget where this is coming from. It's junk science. It's a political agenda. It's all from Donald Trump's executive order 14168, which is all about legally erasing trans and intersex people, or simply put, seeking to define narrowly sex as these binary immutable characteristics. And this new HHS directive isn't a law, but it's a signal. And that is that there's a war against LGBTQ rights. And if you thought Kennedy was some independent thinker who'd shake up Washington, you need to think again. He's governing like a far-right puppet. And this isn't about science. Guys, this isn't about science at all. This is about control. It's about giving states, agencies, and employers a green light to discriminate, whether that means denying healthcare, restricting legal protections, or making life even more challenging for trans and intersex Americans. And if history has taught us anything, moves like this don't just stop at one memo, they escalate. RFK Jr. promised independent leadership at HHS. Think again. His department just cranked this anti-LGBTQ plus agenda to the hills, erasing trans and intersex people from legal recognition. It reduces intersex people to these rare disorders of sexual development. It's basically doing away with science. And, these intersex advocates aren't staying silent. There's the group Interact called it what it is. It's unscientific, politically motivated attack. And the Trump administration's completely ignoring these LGBTQ community. So I want you to know this isn't just the beginning, right? We are in for a fight. Make no mistake. This attack on the LGBTQ plus community isn't just an isolated strike. It's a test run. By stripping away hard-fought legal protections that took decades of struggles and activism to secure, the current administration is laying the groundwork to erase not only their rights, but our rights and the rights of anyone that they consider other. These protections were fought hard legal battles. And now, with the stroke of a pen, with a simple memo, all of that work, all those hard-won victories are being erased. And this is setting a dangerous precedent for what's coming next. This isn't just this assault on LGBTQ plus rights. It's a direct attack on long-standing American freedoms. They are stripping away the core values of equity and equality that this country is built on. This is an attack on our liberty. And we cannot afford to stay silent. We've got to fight. We can't afford to wait. We've got to fight back. What do you think, Dr. Sloan?
I think you're right. We are in for a big fight, and people have to join on to organizations such as even the Human Health Rights Campaign, like President Kelly Robinson stated. An attack on our rights threatens the rights of any person who doesn't fit into the narrow view of how the current administration thinks we should look or act. So we have to fight. We have no choice at this point. They've backed us into a corner, but you know what they say about backing someone into the corner. So let's watch this clip.
Kennedy has no experience in public health. He's an environmental attorney, but that has not stopped him from being one of the leading proponents of anti-vaccine conspiracy theories for years. So what does this mean? Joining me right now is Dr. Paul Offit, the director of the Vaccine Education Center at Children's Hospital of Philadelphia. He's also a member of the FDA Vaccine Advisory Committee. Doctor, thank you. Before I show some of what Kennedy's views on public health, overall, what do you think RFK Jr. having power over public health in this country will mean for this country?
Well, to be honest, I can't believe we're actually having this conversation. I mean, if you look, that science and technological advances have allowed us to live 30 years longer than we did 100 years ago. And now you have this man, Robert F. Kennedy Jr., who's a science denialist, a virulent anti-vaccine activist, a conspiracy theorist, who will have some sway over public health. Nothing good can come of that. He denies those advances. He simply declares his own scientific truths. It's a dangerous moment.
Dangerous moment indeed. And so let's look. I think RFK Jr. has met the moment. He's done precisely what we feared, turning the Department of Health and Human Services into his playground for these anti-vax agenda. Because guess what? It's now purging vaccines and even the advisory committee, the people that basically have science and proof behind this that could possibly help him in this process of the due justice this department deserves. He's getting rid of them. In fact, their initial meeting today was actually canceled. So yeah, some expert panels that could actually help you ensure vaccines are safe and effective, he gets rid of them. And why? He says that big pharma has too much influence. I mean, you guys, I can't make this stuff up. Let's be clear. Keeping industry influence in check is essential, is what he said. But this is coming from RFK Jr., and that's like someone having a huge carbon footprint telling them to, check NASA because they don't want to deal with not just Earth, but outer space and tearing down the house because no one can survive. They just want to be in control. This guy has spent years spreading misinformation about vaccines, sowing distrust in science, and now he is the HHS secretary. He's got all the power to shake up public health policy from inside out, and he's doing it in his first week. And get this, his team hasn't even figured out who they're going to fire yet, but the CDC's vaccine policy committee was the first ones to go. So yeah, the FDA advisors better look out. I'm sure they are next. So meanwhile, public health experts are sounding the alarm because, shocker, gutting this advisory board will undermine the trust of what? Vaccines at the time we really don't need any more nonsense, you guys. And here's the cherry on top. RFK Jr. swore, remember, he swore in his oath during this confirmation hearings that he would not undermine the faith of vaccines. But what's his first big move out of the gate? Targeting the very people responsible for vaccine safety. So if you thought RFK Jr. was going to play nicely and be cool in his new role, surprise, he's doing exactly what we thought and what most extreme supporters wanted. He's blowing up public health from within. So what's next? Replacing the actual experts with fellow conspiracy theorists. Mark my word, it's coming. So holding CDC meetings whenever he feels like it. We don't need those anymore. And I guess that's the way that things are going to go, just the way he wants to do it. The bottom line is RFK Jr. is not draining the swamp, you guys. He's flooding it with bad faith actors. And unfortunately, your health and my health are on the line.
Look, Dr. Sloan, as we close today, I want to give our viewers reasons why they should stand up and fight. In a recent eh-yah podcast interview with Dr. Bonde Virgil, a board-certified pediatrician and host of the podcast, The Children's Wellness Spot, she stated, quote, "Children cannot speak for themselves. We have to be their voice, and vaccines allow us the luxury to take care of chronic disease in kids and adults if we can get them to live past the first few years of life." And she has also recommended that if you do nothing else, regardless of what political stance you take, you have to find a trusted voice and do your research. One trusted site is from the American Academy of Pediatrics, which the site is healthychildren.org.
And we hope that site stays up, as so many have come down but definitely a trusted voice. That was the best advice she gave. So thank you for watching. We are eh-yah, contributors of MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Bye-bye.
Love this video? Make sure you stay up to date on the latest breaking news and all things Meidas by signing up to the MeidasTouch newsletter at MeidasTouch.com/newsletter.